Hello and welcome to our Fascial Fix for shoulder pain. Many people develop shoulder pain. They might be given a diagnosis of, for example, rotator cuff injury or frozen shoulder, but the main issue is that they have a shoulder that is painful to move. In this video, we're going to go through some simple myofascial exercises that can help to alleviate shoulder pain by reducing the restrictions in the fascia surrounding your shoulder. In this exercise, we're going to do a side stretch. There are lots of muscles on the side of your body that help to rotate things. They also help to allow your shoulders and your arms to move freely, and sometimes these can become stuck. So to start, we're just going to tip the head to the side and then allow your body to come with your head. So the stretch is in your upper body initially, so you probably start to feel it in your neck first of all, and then maybe your shoulder, and then more coming down into the side of your torso. And if you want to create a deeper stretch and it feels comfortable for you, then you can bring your arm up over your head. And so this also then stretches into your armpit, the side of your arm, the side of your ribs, your chest, and all the way down to your waist and your pelvis. This is a really good stretch for opening out the whole of the side of your body. And there are so many muscles and tissues in this area that affect the movement of your shoulders and your arms. And when they become restricted, they can cause problems with shoulders. They can cause or contribute to RSI type problems in your hands and your wrists. They can affect your breathing and even down into your lower body. So around your waist and your hips can be affected. So stretching like this, you can do seated, as I am. You can do this standing. It's a good idea when you start to do this to do it against a wall, which can support you and make sure that your body's not tipping forwards too much. And then as you come out of the stretch, as long as you've been here for at least a couple of minutes, then gradually come out and allow your body just to relax and assimilate the stretch. For the other side, I'm going to use a couple of pillows as a way of doing this stretch in a more relaxed way for some people who may find it difficult to sit or stand to do this stretch. So pillows are a good idea. You can also use something like a gym ball if that's comfortable for you. So I'm going to bring pillows here and I'm going to lie over these. So making sure that the pillows are supporting around my waist, which gives me a stretch in the side of my body. So just allowing your body to relax. I'm going to let my head and my neck relax. So I start to feel a stretch into the side of my neck and my shoulder. I'm feeling a stretch coming in around the hips here. And again, if it's comfortable, I can bring my arm up over my head and just allow it to rest on the floor. So this gives a lovely stretch for the whole of the side of the body. It really opens things out. It's very good in particular if you're somebody who does a lot of computer, desk work, where everything is in front of you and your body is very restricted. This opens out your shoulders, it opens out your arms, it opens out your chest, your ribs, the whole side of your body. So it can also help with breathing It can help with lower back pain because it's helping to stretch some of the tissues lower down that feed into your lower back. So as long as you're here for at least a couple of minutes, then it will allow time for the fascia to start to release and let go. In this exercise, we're going to use 2 myofascial balls to work on the front of the chest. So the area that you want to place the balls is on your chest. So if you feel for your collarbone, which is at the top here, and then your shoulder joint, which you can feel at the outside, and then just in the corner here is a little pocket, like a little dip, and that's where you want to aim to place the balls on either side. So I'm going to lie on my front with 1 ball on either side of my chest. So when you're here, just lie flat with your head on the floor if it's comfortable. If you feel you need a little pillow under your head, that's also okay. And you can have your arms in whatever position feels comfortable for them too. By having your arms down by your sides like I have, this is putting the maximum pressure through the balls into the tissues of your chest. If it's not comfortable to lie like this on the floor, then you can do this on your bed, or you can also do this leaning against a wall, but you need to do that one side at a time. So while you're here, just allow your body to relax around the balls, and you'll get a sense of the tissues in your chest starting to release and let go. This area is important because when your chest muscles are tight, they pull your shoulders forwards, so they create a rounded shoulder position. They also can put pressure on your arm nerves as they travel from your neck across your chest down to your arms. So sometimes when this area is tight, it can contribute to RSI and other problems that are felt in the arms and hands. Doing this exercise in conjunction with a ball exercise for your upper back is really good, because then you're releasing the front and the back, and this allows your shoulders to start to drop back into their proper position. So while you're here, as long as you stay here for at least a couple of minutes, then it's allowing time for the fascia to start to release and let go. So in this exercise, we're going to use a myofascial ball to work on the deltoid. So the deltoid is a muscle that sits like a cap on the outside of your shoulder. So you've got one on either shoulder, and it has 3 parts to it. There's a front bit, a middle bit, and a back bit. And each of the 3 parts do different things. So the front bit brings your shoulder and your arm across your chest. The back bit brings your arm and your shoulder round behind you, and the middle bit lifts your arm up sideways towards your head. So if you have restrictions in any of these parts of the deltoid, this can restrict the movement of your shoulder and your arm. To work on this, we're going to use the ball, and I'm going to place the ball on the wall onto my deltoid, and then just lean in. So I'm waiting here for a sense of the tissues starting to release and let go. The deltoid muscle is surrounded and encased in layers of fascia, and so if these get stuck, then this restricts the movement of the muscle and its ability to do its job. So while you're here, just noticing how things feel, maybe getting a sense that there are certain points that feel tender or maybe are referring pain elsewhere. You may get a sense of pain coming up into your shoulder and your neck and your head, or maybe coming down into your arm and hand. So whatever you're feeling, that's fine for you. That's your release pattern. And as long as you're here for at least a couple of minutes, then the fascia will be starting to release and let go. And as you're here, you can start to move very slowly around the ball to access the other parts of your deltoid. So turning this way towards the front, I can get more into the back part of my deltoid, and again just noticing any areas that might feel tight or restricted and waiting for those to release and let go. And then I can rotate back round so I'm facing into the wall, and that's more accessing the front of the deltoid. And again just waiting for a sense of this starting to release and let go. And we can also work on the other side. So again, using the ball, just placing it on the wall and just leaning the deltoid area into the ball. So you've got a nice pressure. You can feel the pressure of the ball against the muscle, and just waiting for a sense of things starting to release and let go. So deltoid is very important in terms of your ability of your shoulder and your arm to move freely, and quite often these can become restricted. So particularly if you do sports where you are doing rotational movement of your shoulder, so for example tennis or swimming, or if you've been doing a lot of decorating at home, so for example if you decorate ceilings and you have your arms up above your head for prolonged periods, this can sometimes cause the deltoid to become restricted as well. And again, as things start to release, you can start to rotate slowly around the ball, coming first into the back of the deltoid to see if anything feels restricted or painful here. And once you have a sense of tissue starting to release, you can slowly rotate round and come round to the front of the muscle. And again, just waiting for a sense of the tissues starting to release and let go.